Welcome to Ephuenyim Health Center. I am Sarah, a health worker at Ephuenyim. The history of Ephuenyim Health Center took us back in 2005 when the community women members levied themselves to buy cement and kick off the construction. Later, the community got their support from the Action Aids and completed the construction.
You are in Pere Teconobule, Ekuwanya, and we get one maternity health center. Emeka, Chineke Razanye Pere. The Wolftaranye, Wukota, Rabo Data. We shall end them with Kedra, Obodanya.
And then, Ephuenyim Health Center was officially opened in 2010 with over 25 staff strengths, including the resident doctors, the midwives, the medical lab scientists. Today is 30th January. Today is our antenatal care day.
I am here in Ephuenyim Health Center for antenatal care. These people, the AMURT and their workers, they are doing marvelous to us. They normally take accurate, proper care to the pregnant women in this Ephuenyim Health Center.
During the antenatal clinic days, we normally check their obstetric measures and check how the baby is doing, whether the baby is still viable or not, the gestational age of the baby, the fetal weights, and if there is any complication, the ultrasound scan will also help us to detect it. So in AMURT, we provide a comprehensive obstetric care.
We are here to help screen the women and children. More especially during ANCs, we run many tests.
She delivered last month and she came back to receive one of the services on family planning.
Here with me are my nourished children. At the first contact I met them in their houses, they were so bad, their marks were very, very bad at the danger line. But after introduction of my nutrition food called RU2F, they started responding effectively.
Ephuenyim Health Center has an average of over 15 patients on admission at all times. Since we started, more than 4,700 babies has been born at the health center.
And here with me is my patient. She just delivered early hours this morning with a bouncing baby boy and a girl as a twins.
Making emergency obstetric care accessible and affordable to women in the rural area is our great priority, with over 300 cesarean sections.
Since the building of this theater at Ephuenyim, here we have done the cases of obstetric labor referred from different TBA, and we have had emergency children surgery cases that have saved so many children from dying.
Ephuenyim has served as an emergency obstetric referral center.
It is a case that we cannot handle here, both the doctor on ground and maybe this is a very serious case that needs a specialist review. We either invite the consultant to come and help in the surgery or refer the woman because we have ambulance services.
I'm an ambulance driver. Sometimes I can move at 2 o'clock, 3 o'clock, 1 o'clock. Anytime at all they call me, I will go.
Which is always available. We make a call before we finish the preparation. The ambulance is here in the next 10-15 minutes. The woman is referred with the assistance of a paramedic.
AMURT Scholarship Program builds local capacity by offering opportunities to youth volunteers to become qualified health workers.
AMURT trained us as a trainee for 3 good years and gave us scholarship to study as a community health extension workers for good 3 years. Then after that, we continue with AMURT and start working at the Ephuenyim Health Center.
Community participation is the key to AMURT primary health care model.
The work of AMURT in Ephuenyim Health Center, since they came, they made a lot of progress. the station they made to every village makes the women of this area to know the need of delivering in the hospital.
Close to all the staff are from the project areas and neighboring communities.
Ephuenyim Health Center is community owned and community managed. All the health workers come from the project area. The Health Center Management Committee is composed of representatives from the villages. This has been key in building community confidence and sustaining 24-hour service every day. Through careful management of the drug revolving fund, Ephuenyim Health Center covers all its operating expenses, pays support staff, and still creates savings, which made possible the construction of staff quarters, operating theaters, and a second clinic building. Ephuenyim Health Center is an example of the AMURT model of government, community, and private sector partnership to make primary health care work in rural Nigeria.